Sure, thank you. And I wanted to follow up a little bit more, Dr. Zomchek, about the EPS scheduling and how that has been integrated. I know it's not fully at every facility yet, and I'm curious in your vision where it's being used and how it's being utilized, and if you have any feedback for us as to how that's going in its real application sense now.
Yes, thanks for that question. EPS, I'm well aware of it. Part of being the governance board that's been discussed for a number of months now, and so I've been involved in those discussions and in the rollout kind of input about the planning. At this point, we don't have any of our 8 facilities in Vision 12 that are in the pilot, as you had mentioned. However, I think it's a great thing. I think it's a wonderful opportunity to provide more resources and access for our vets and timeliness. I mean, literally, it's moving appointment scheduling from days or weeks in some cases to the period of minutes. So I'm encouraged about it, and but I do think it's a double-sided coin idea in terms of implementation, right? You really need the local medical center to be, engaged in opening up those clinic slots, but you also need the community partner and a connection like CEO to CEO to open up those grids and then kind of get proof of concept so that it can be expanded.
Sure. For those that may be here today unfamiliar, it would basically, when you call to schedule an appointment, often in community care, I had this example happen to me. I had an audiology appointment, and they had to first call me and get my availability, then call these other providers that were available, then call me back, and they scheduled it at a time I told them I wasn't available. And then they told me, well, when that happens, we just schedule you for the next appointment if we can't meet your timeline that you're available. And I'm like, well, I'm literally going to be out of the state. I'm going to be in Washington, D.C., and you scheduled me an appointment in Michigan at the same time. And it was a very significant hassle. And so I think having that real-time awareness so you're not going through that game of telephone is really critically important. And so I think you're right, though. You need both the VA scheduler as well as the community care provider to opt into that meshing of information so that scheduling is going to be available for people. And then they can know what's close to home, what's available, and what am I willing to travel farther for, or what's nearby and timely and everything else. And I think that's an important thing that we've got to kind of pull together, basically. Dr. Kaboli, on that piece of it, have you, and maybe, I'm not sure if you have awareness of this, do you feel like there is that awareness and buy-in by potential community care partners when we offer this to them, that they have that willingness to participate?
Absolutely. So our office has followed the external provider scheduling program for the last 3 years, and we've worked, for example, with the Nebraska Rural Health Association, because they're really tied into the rural communities, and saying, we will partner with you to make sure that they're on the grids. Because like you said, if the scheduler has access to both grids at that exact moment in time when they're on the phone with the veteran, they can say, we can get you into the VA in 32 days, or we can get you into this other clinic in 47 days. Which would you rather have? Or, and so I think if it works half as well as we hope it does, it'll still be good. But I think, I think they're up to what? There were 4,000 appointments made last month in June. Mm-hmm. So it's ramping up quickly. So I think it'll prove to be mutually beneficial, and that's where it'll work.
And I'm not sure if this is a best question for you or not, but the community care partners, do you feel that they feel like they are getting I mean, everybody always wants a greater reimbursement, but do you feel that it at least is a market reimbursement rate that is something that will draw in community care partnerships?
Yeah, so we've gone around and met with community, partners, and I still practice in Iowa, and I talk to these other providers all the time, and they're happy with the rates that we provide. It's just you have to make it easy. The harder you make it, especially with record exchange, the harder we make it, it just becomes a hassle. But I think they're really committed to the veterans and their community, and I've never heard anybody in the community ever say, you know what, taking care of veterans is not a priority for us. They
Yeah.
always want to care for veterans.
Yeah, and we want to draw in the best that we can by having a reimbursement rate that's reflective of the service that's provided, that does that, to really strengthen those particularly rural community partners that we have. So thank you. I can yield to the ranking member. Do you have other questions?